back to Wylde on Health. Leaky gut syndrome is somewhat of a mysterious disease. It can show itself as a bewildering array of other conditions. In fact, most people who have it don't even realize. So when should you get tested and which tests are best? Dr. Trotter, we're going to go to you about this first. We have a number of kits. By the way, these are functional kits. These are mainly available through naturopathic doctors and functional medical doctors, correct?
That's right.
It's not your OHIP walk-in practice.
It's not under the OHIP paradigm.
Right.
But so the first kit that is quite specific for intestinal permeability is it's measuring two sugars, lactulose and mannitol, and based on the ratio of the output through urine, it determines if you're absorbing sugars that are larger than you should be absorbing, and also if you can have the combined malabsorption of sugars that are normally absorbed.
Okay, what kind of samples are you collecting to determine that?
So it's quite non-invasive. So initially you're doing an 8-hour fast and you're doing a urine sample, and then you're drinking a solution of lactulose mannitol, the two sugars.
Yep.
And after you're collecting your urine for 6 hours, and after that point in time, then you're taking another sample, and then you're measuring the ratio of lactulose and mannitol output in the urine. And based on that, you can determine if you fall into the category of intestinal permeability or not.
As we described in the first pack, which is quite easily thought about as permeability or hyperpermeability, as you quite appropriately termed it, but just basically things getting into the general circulation that probably shouldn't be there. Your immune system says, hey, what's that? Attacks it, and then therefore is confused and might manifest as other global body-wide symptoms.
That's right.
How else can you test for this?
So that first test is essentially telling us whether you have leaky gut or not, and then the other two tests, one is a food allergy test, an IgG food allergy test. That's different than your conventional classic allergy response where you have things like hives and immediate type responses. So This is a delayed type sensitivity. Responses can be things that are more chronic, that can mimic things that you'd have as a result of leaky gut. Now, it's kind of like a chicken and the egg, because leaky gut itself can aggravate food allergies because you're allowing undigested food particles into the bloodstream, which is sensitizing your body. And at the same time, food allergies can also sensitize you and create problems with leaky gut. So you want to remove one of those components. Okay. So it's a test. It's a simple blood test. It's just a finger poke. Measures anywhere from 96 to 300 common foods in your diet, and by removing those foods, then it can help to decrease inflammation in the digestive tract.
And then you also have a stool collection kit, which is used for what?
So this is a 3-day stool collection kit. So it's considered non-invasive, depending on what you think is invasive. It's different in terms of the OHIP, as you mentioned, the OHIP-covered stool test, in that it'll give you the balance of dysbiotic bacteria, which is unhealthy bacteria, versus your good bacteria, mycology or yeast culture. Yep. And then from there, you can determine if you need to rebalance your the gut flora.
Good flora, right?
That's right. And then further to that, there's also a component that has comprehensive stool analysis, where we're looking at different inflammatory markers and digestion, absorption in the digestive tract.
And what I love about this test to arm you as a naturopathic doctor is when you find there may be some issue like mycology, fungus, yeast, bacteria, it also says, because it'll typify which natural, even conventional approach, pharmaceutical drug, is this particular bacteria or fungus most susceptible to, and it gives you the idea how to best treat it.
So the great thing, when you have tests, it's important to look at how is this going to affect my treatment plan, and this gives you very good information about specific treatment plans that you can follow to help the patient's health.
Love it. And we only have about 30 seconds before break, but some of the conventional methodologies and approaches.
Right, so what conventionally we'd get someone to do an ovarian parasites and parasitology and culture and sensitivity of the stool, looking to see if they have an overgrowth of Clostridium difficile, or if there is Shigella or other toxins on board. Because
all of these things can create a permeable bowel.
That's correct, yes.
What we talked off camera real quick, and again, you can even use an at-home like tape on the anus if you consider you won't worry about parasites.
If you're thinking about pinworms or things like that, certainly an overnight Scotch tape test would be helpful.
And I've heard, Dr. Trotter, I don't know if you practice this or you're of the ilk that believe this, but considering moon cycles and the activity of parasites in the system, potentially missed when it's non-moon cycle and then finding it when there is.
That's right. So, I mean, depending on your belief systems, the moon cycle, there's indication that parasites grow closer to the full moon. So when you are doing a parasite test, often, you can recommend doing the parasite test close to the full moon, just to make sure you're not getting false negatives.
Excellent advice, excellent stuff, guys. Up next, 2 apps designed to flush your fears of digestive disorders. Don't go anywhere.
reach us in the GTA by dialing 416-872-2724 or outside the area at 1-888-863-2724. Send an email to wyldeonhealth@cp24.com or follow Bryce on Twitter by visiting cp24.com.